Hi guys, I want to specially again welcome you, for another episode of Stories, and this is such a profound one. Um, this is one conversation you really want to sit back and hear, and particularly because we have received loads of calls as touching what we're about to talk about, and we thought it's good to give you insight, right, into our operations and the things that we do. And I have with me today Femi Lazarus, who is the director of Free at Last Rehabilitation Center. You want to introduce yourself a bit more?
Yes, thank you so much for having me here, Apostle. I really appreciate being here.
Thank you.
Such an honor. I'm the director of the Free at Last Rehabilitation Center, and it's such an honor to be doing an amazing work there. Thank
you. All right. And so you have you are the director, so you want to introduce your...
Okay.
Yeah.
All right. So here beside me is Adela, our living nurse. Please continue.
Okay, so my name is Adela, and I'm a living nurse at the Free at Last Rehabilitation. Thank you so much, Apostle, for having me here as well. It's an honor, it's a privilege. Thank you, sir.
Thank you. So let's, conversations around the subject of mental health is such that I think people of faith avoid for some reasons. And permit me to also say in this part of the world, for some reasons, issues around the subject of mental health is not taken as matters of utmost importance. And from your experience out there, trying to help young ladies who are introduced to vices, drugs, prostitution, and all that, what do you see to what is going on really in our society today?
Okay, so just like you said, mental health is something that is truly in the faith. It looks as though if you're not able to pray to God or say that, oh God, help me, or meet a pastor, going through the route of mental health is like saying that you don't have faith. So many times, many people go through a lot of things, depression, anxiety, and they don't know who to talk to. Recently I had someone who reached out and she said she had a counselor in church, but the counselor doesn't know that she's still dealing with her drugs because she's afraid to tell the person who is a leader in church. So even though she has opened up, told the person, and then it looks like, oh, I'm the righteousness of God in Christ Jesus. I understand that. Yeah. But I'm still struggling with this and I don't know how to come out of it. I keep struggling over and over again. And I'm at the point where I'm tired of even saying that this is what I'm going through because I don't want to be judged, So there's that thin line. While in the case of going to see a therapist, for instance, you're coming into a zone where you already know, or you're being told that it's a no judgment zone. Although I've also heard the other part of it where some mental health therapists don't go through the thorough way because they are Christians. They start to use, they say things like, oh, just like the same thing she experienced with the leader in church, they go through do this, do that, then read the Bible. Like she said, they say read the Bible and that's all. But, with mental health, it's become so, I'm trying to look for the word to use. It's become so needed in the world that we are in. It's so much needed.
To have conversations around mental health.
Yes.
Now, Adiola, you've been a nurse with vast experience. You worked in psychiatric hospital before.
Yes, sir.
And you've seen, and I remember behind the stage, you were telling me that we have more cases of psychosis.
Yes, sir.
Than neurosis.
Yes, sir.
And these are very serious. You want to just throw light because many people don't even know the difference. And then we now get to the issue of the gender spectrum of this. Yes, please.
Okay, so psychosis and neurosis is a term used in mental health.
Yeah.
So for neurosis, now let me start with that. So neurosis is something very basic. It's not as deep as psychosis is. For example, in neurosis, they don't have something like hallucination. They don't hallucinate. Yeah. So for psychosis, one major thing we see in psychosis is hallucination. So it's more like the depth of the mental health itself. There are people you see on the streets, it's psychosis. But people that come up to you to tell you, oh,
psychosis in the sense that this is a psychological issue.
Yes, sir.
That is predominantly caused not because of a neurological defect,
yes,
but because of the introduction of substance.
Yes.
Is that what you're saying?
Yes, yes, sir.
Continue.
The substances, addiction. Okay, so people we see on the streets, that's psychosis. And many times they come down with hallucination. Once we see hallucination, then that's psychosis. So many times they don't even have to come to a rehabilitation center directly. Once they start manifesting some symptoms, they just have to go to a psychiatric hospital straight up. And then once they've stayed there for a while, they are now well managed, then they could always come into the rehabilitation center.
Okay. Now let's talk about our rehabilitation center. Free at Last Rehabilitation Center. It's been a roller coaster, I know. This is, should I say, like a form of feedback, but also more to bring people into awareness of what goes down to make, rehabilitating a person a reality. So far, what's your experience like?
Okay, so far, it's been, first of all, I'd like to say it's been quite interesting. We've had a couple of residents that have come in, and they all had different personalities.
Oh, definitely.
Different issues, different personalities. Managing them was an experience. So we developed a routine that would cater to everyone individually. So based on that, we know that, okay, this person for a period of time, they can't attend to some of their routines because maybe they are going through relapse. So the nurse tells us, okay, she can go ahead and, go for sessions. Sometimes they can't, they are resting, But then at the same time, we've also had a couple of them who went violent, one or two occasions. And managing that in itself was also an experience because we had to immediately separate one of them into a separate room. Go there, speak to her, calm her down to a point where she's relaxed
now,
enough.
You're not speaking hypothetically here. You are talking about some real-time experience you've had.
Yes.
Come again with what you just said.
So we had, for instance, we had a resident who had an issue with another resident based on conversations, and she immediately slapped the other residents, So we had to separate them immediately, separate one, but she was really violent, and primarily it was because she was going through relapse. So due to that, we had to separate her into another room. The things she was saying wasn't very coherent. So I knew that she just needed to calm down a bit. So we had to separate her for a while, calm her down, speak to her, ask her questions, just talk to her in a way that she's calm. Just calm down, take your time. What's going on? What's happening? Just give her that, provide that, and I always tell her, even in your bad time, even in your worst time, I'm here for you. I'm present. You can talk to me. And then we end up the sessions, we cry. She would cry, would hug each other. And she's like, okay, I'm fine, And, the other person who was slapped, you have to also tell the person, she's also going through, so speaking to them. So we had quite a number of experiences doing all of that with different, the routines, and also even with the staff, them doing their work, the nurse, the resident assistant, the chef providing meals, and just providing a safe space for everyone.
I understand that I am Femi Lazarus. I understand that this is a rehabilitation center that is really being managed by us. That is, we started this.
Yes.
So I don't want to ask questions with assumption. At this rehabilitation center, people live in.
Yes.
Stay in.
Yes, they stay in, come in.
Yes, so they are residents there.
Yes.
All right, and it's free. It's
free, completely free.
Okay. So I'd like to ask, what's your worst experience so far?
My worst experience so far would be one of the residents who came in and was forced. Okay, I think I don't know if I should say just one, but I wouldn't call it my worst experience because
more like a bad experience.
Yes, I think one of it would be seeing one of the residents who left in the condition where she left, and I think there was a pain that I had in my heart that was so much, especially when I found out that for all the sessions that we had, everything she had told me was completely, like, it was all a lie. And these were sessions we had that was
So you
almost,
sat down in therapy session
yes.
and you were asking questions
Yes.
about our life.
Yes.
And everything she was saying was a lie.
Everything. And she would cry. You know, it was so compelling. I was, you know, providing everything, saying everything that I needed to say to her, you know, and it was just so sad to eventually find out that they were all lies. So she eventually left because it looked as though she was forced to come in by her family, you know, based on, oh, if you don't go in, we won't do this for you, we won't do that for you. And that was very painful. That experience wasn't good for me at all at that point. But then it was also a learning curve. It was a very huge learning curve because it also showed that different kinds of people can come around. Yeah. And that was where I also learned that if you can't help someone who doesn't want to be helped.
Definitely.
That for me, that was just it.
So this means that going to a rehabilitation center is not automatic.
No, it's not.
It is important that the fellow who is, let's, for instance, a rehabilitation center like this, that is completely free. It doesn't matter how wealthy the person's family is, it's completely free.
Yes.
Everything is catered for, the drugs, the food, the accommodation, everything. Even that is not enough. It is important that the fellow who is coming in is ready to cooperate with the process.
Yes.
To be free.
Yes.
Now, there's a question I want to ask, and this will concern, but I start from the nurse.
Okay.
Can you tell the public about the procedures or the things that we consider in respect to vitals before admitting someone into the rehabilitation center? Or people can just come into the rehabilitation center without any check, no test, and all that. You want to run us through that?
Okay, sir. So people cannot just come in to the rehab. We have some medical tests that we take them through before they come into the rehab. Now, if they pass all through these medical tests and they are not positive, then we bring them in.
You want to give us an example of this medical test?
Okay, so HIV is one of the tests that has been run. Hepatitis B, hepatitis C, they have to do a urine drug test as well, because we actually know that these people are actually addicted to drugs. So just to find out what drug exactly is in their system, because that would make us know the kind of withdrawal symptoms they will have and the kind of drugs to also administer. So we also do, that's the toxicology, the urine toxicology test. Then we also do eye vaginal swab as well for the females. So those are the tests.
And pregnancy tests.
Yes, and pregnancy tests.
To check for infections?
Yes, to check for infections.
Infections. So now, most people, like I said, conversations like this is not one that people of faith are convenient to have. Let's talk about the risk of having someone who is HIV positive in a rehabilitation center. Now, this is not about stigmatization. You as a nurse know better not to stigmatize.
Yes, sir.
Is there any danger in having let's say, patient with HIV, join the rest in a rehabilitation center like this?
Okay, so
what are the dangers?
Okay, firstly, I would say that if the HIV positive patient or people are not being brought into the rehab, then what's their fate if they are left out there? Because that means they're being stigmatized. Okay, so it's just to take proper precautions to ensure that they don't spread it to others as well within the rehabilitation center.
So I understand that so far, this rehabilitation center has not been admitting people that are positive, which means that it is an aspect of this rehabilitation center that is open for reconsideration.
Yes.
Okay.
Yes, of course. We have to reconsider that, because if we're leaving them outside, then that's stigmatization already.
But what if now something happened years back? A woman was falling sick and she went to see the doctor, and having examined her, could only recommend one more test. And that was HIV test. She went for the test and she was positive. And that was quite alarming for a woman who has been faithful with her husband. So the only suspicion now will be that the man has been unfaithful. The man was recommended to go for his own test too and came back positive. As at that point, they had 5 children. They tested all the 5 children and they came back positive. And that was when, in asking the questions, they found out that the house help they brought to the house was not tested, was HIV positive, and I'm trying to remember now, was it that she bled into water, something like that, for the entire family? Yes, she infiltrated one, I can't remember precisely, and got everyone in that family infected. Now my question is, in a rehabilitation center where people have different reactions when there is relapse, how do we reduce the danger of such happening?
Okay, so I would say,
And I'm still going to get that to you too. What are the safety procedures that we keep in this rehabilitation center? What are the items that they have access to and what they can't have access to? Yes, please proceed.
Okay, so like you said earlier, the example you just gave, HIV is being contacted through the body fluids.
Yes, please.
And also sexual intercourse.
Yes.
Unprotected.
Yeah, interaction of body fluids. Yeah.
Yes, so blood and all of that. So definitely she could have infected everybody through that means. So, okay, using that example, the first thing is the residents don't have access to the kitchen. Okay, the kitchen is, we have restricted areas.
In the house.
Yes, in the house.
Yes.
So, and one of the restricted area is the kitchen. So they don't have access to sharp objects like knife.
Not at all.
Not at all. Not at all. Blade, knives, even the needles in the clinic, they don't have access to it.
Okay.
Yes. So, and of course, it's 1 needle per person. That's even if, and we try to also reduce the use of needles. If there are drugs, rather use drugs than also give injections to reduce that risk for transmission. Yes.
I know some hospitals do boil needles to disinfect. Have you heard of such before? It's not an ideal practice, but
yes,
for some, this is a blessed country. For some health centers where they have limited supply of resources, I've personally seen that as cheap as needles can be. I've seen where they boil needles for reuse. You've not seen that before?
No, sir.
Oh, interesting. I grew up from the north, so I've seen things. All right, let's talk about the safety practices in the house.
So just like she said, they don't have access to the kitchen, sharp objects. So most of what they use are personalized. So in fact, there was a point we had to get even to how they eat, just for colorful items. We got them personalized items. So everyone has their cup, their spoon, even though that is not going to, just to ensure that.
It's important. And I'll tell you why I said it's important.
Yes.
There are things that, sometimes I get the fuss about HIV and all that, but there are conditions that are quite more deadly. Like hepatitis. Now, they're very serious. In fact, you don't even need sexual interaction for some to be communicated.
Yes, sir.
And that's why I really want to commend the idea of personalized items.
Yes, they have personalized
that's so
items.
Powerful, so important.
And we also try to not use metal. So they use more of plastic, but not the ordinary ones that you just find on the streets. Something that looks really good, but they also understand that it's for their safety. You know, so they have that understanding.
How many HIV positive individuals have you found?
In the course of where we started.
What percentage?
I think just going out on the street and then meeting people, I would say that I don't want to give you a percentage. I'm not very sure.
We have tested at Free Atlas.
Quite a number of them.
I would estimate up to 80%.
You'd be right. You'd be right. Quite a number of them. Yes. And it's really heartbreaking. But yes.
Many of them don't even know that.
And they don't know until they did the test.
Yes.
Many did not know that.
No, they didn't.
Yes.
And many of these girls still go out there
having
unprotected sex with people. Okay, you were talking about the safety procedures.
Oh, yes. So also, for the one who is positive, we also do give them an orientation. I think it's important that we all give, if we have one who is positive coming in, we give them an orientation that says, okay, you know that you are. So it's important that you also try to ensure that you don't use certain things that could, or do anything that could harm another person.
Yes.
You know, so they understand that fact, and then they are able to ensure that, you know, they don't endanger anyone else. We also separate their rooms, separate from the other one. Those are the considerations that we are having at the moment for when we have people who are positive.
Yes. Okay, I mean that's profound. I know many of these things are subject to, and I want to really give a public thank you to Dr. Bukola Williams, who has been an amazing blessing to us. He's been a genuine blessing to this center, who is a psychiatrist. They are one of the best consultants you can get in this country. And I want to thank him for working side by side with us to ensure that we're able to, you know, get all these things done. But let me ask a few more questions.
Okay.
As touching the rehabilitation center, because there are people who has been reaching out. I've gotten a few mails also and messages from people who want their loved ones to enroll. You've been talking about the female gender since we started this conversation. Why is that?
Okay, so the facility we have at the moment is just for the females, while we are working on the facility for the male to be launched, hopefully very soon by God's grace.
Yeah, very soon.
Yes, so currently we only have a facility for ladies.
8 out of every 10 mails I receive about from people who want to bring their loved ones to rehabilitation center.
We receive calls every day.
Has to do with males.
Yes.
Now, from your experience working in the psychiatric ward, will you say that more males tend to come down with psychosis?
Yes, sir. A lot of them. A lot of them get into drugs, addiction, many of them alcohol, name it.
That's an official statistics now. That you're saying that males abuse drug more.
Yes, sir. Yes, sir. They do. They do. I've witnessed it many times. I worked at somewhere else, and also, in a ward full of, like, let's say 20, 24 beds, the whole ward is filled up, so that if someone else is coming in, there's no space to admit them. But in the female ward, you're seeing just like 3, 4 in a bed space of 24.
What's your worst experience psychiatric unit?
Okay, I've had a number actually. I've seen children with psychiatric conditions.
But that should be neurosis.
Yes, sir. Yes, sir. Many times it's neurosis. Okay. They are born like that many times. So
bipolar disorder?
Yes, sir. I've seen a number. I've seen a number of them. So seeing that breaks me a whole lot, because I feel this child is still young, doesn't deserve this. Of course. Yes, that actually breaks me a lot.
And if there's someone watching now who is a parent to a child with neurosis, what would you say as a nurse? So, one who is experienced in this field.
So I'll just tell you to not see your child as a disabled. Don't see the disabled part of your child. Just see that good part of your child. See that good part, because it was born like that. And don't say God gave him to you like that. Just take it as this child is not disabled. No, this child is not disabled, because even in the disabilities, we see abilities in the disabilities.
Oh, yes.
Yes. So
I know there's such a principle of compensation where a child has disability in an aspect and then seems to be compensated for another aspect. And maybe, for instance, people who are blind tend to have very high sense of hearing. They get to hear better and can trace the
other sense organs are usually
more compensated for.
Yes.
I mean, that's brilliant to say, and all that. So let me ask you a few more questions. If people want to get their loved ones to come for rehabilitation at Free at Last Rehabilitation Center, how should they go about it?
Okay, so we have a call line.
Yes, please. And I'd like the media to please display the call line on the screen. Is there a mail?
So yes, there's an email. There's an official email.
Is on the screen right away. Yes,
so they
please.
can contact us via email. Through the number is also a WhatsApp line. So you
Okay.
can send a WhatsApp message.
Yeah.
You can also call the number and then we'll attend to you.
Awesome.
Yes, and then of course the whoever is coming in needs to be interested in participating. They also need to understand the duration of the program. Although when they call, we'll give them all the information that they need, but the person must be willing, and it's very important that they are willing
To go through
the process. It's a
processes.
12-month rehabilitation program. So the person needs to understand that as well, that this is what it's going to look like.
In a case where maybe the matter is not as complicated as
Okay.
the usual ones, is there a measure for maybe something toned down, maybe 3 months, 6 months, that can be considered for such people then to be reintegrated back?
It would really need to look into it.
Into such a case.
Yes, into such a case. 3 months, with experiences that I've had, 3 months it's usually not enough.
Some rehabilitation centers around the country do programs for 3
3
months.
months.
But most
detox
times,
programs.
yes,
Most times.
detox programs, yes.
Detox programs.
And most times, 80 to 90% of the cases, they get to have relapse.
Yes. People
Yes, very
still
true.
have relapse even after.
Despite all those
Yes.
stuff.
But because what we do is not just detox where you just come, it's a whole program where you're coming to understand what purpose is like. I also really believe that when people go for rehabilitation,
Yeah.
they get detoxed but there's no purpose to their life. So they go out there and it's just, I'm good. And then they go back to their regular life, living they are the same person that they used to be in a way. They don't really know what to do. Even for those who have learned a skill or a vocation, they just go out there, but there's not so much for them to still attend to. And then by the time they find themselves in that system again, they fall back. And maybe for some, there's no follow-up. I wouldn't know, but I feel like what we do is an awesome healing where you're not just there to say that, I'm being detoxed of drugs. You
Yeah.
find purpose while you're there.
Yeah.
You understand what it means to, even it's faith-based. So what we do is we teach you to get to know God. And for me in particular, one of the things that is very important to me is that they come to know God for themselves.
Yeah.
By the time you're leaving, you should be someone who is able to say that I hear God for myself.
Yeah.
I understand what God is saying to me. I know what God is telling me to do. I know that if I leave this place, in fact, before they leave, they would have started doing certain things outside where they are going out, even speaking, helping other people
Yeah.
before they leave the program.
Yeah.
So it's not just, 1 year and then you're just living there and, doing routine checks. No, it's a program that is filled with so much for the
much.
person.
And I also know that there is the aspect of vocational training.
Yes.
As part of the rehabilitation
Yes.
process. You want to talk about that also?
Okay, so for the vocations, it would come in maybe the 6th or the 7th month
Yeah.
in the duration. That's if the person is going through the 12 months
Yes.
duration, then it will be around that period where we know
The
that
essence of the 12 months, is it for thoroughness? Or for them to be thoroughly catered for?
both.
Okay.
But it's for them to be thoroughly catered for. It's like going to a school and then you stay through for the duration of the school
Yeah.
program. So that's what it's
Yeah.
like. So for the vocations, through sessions of counseling
Yeah.
and determining what your interest is as well, then we understand what you're interested in. But that's not the primary reason why they are coming, because we've had a case like that where it seemed as though it seemed as though what she really wanted was the vocations. And so when she realized that in her 3rd month, she won't be doing vocations and vocations won't be starting at that time, she opted out. She said she wasn't ready to go ahead, so we had to let her go.
So, contrary to what many people may understand, is that sometimes the cases can go bad and the person that you are trying to provide help for looks at you right in the straight to the eye and tell you, I'm not interested anymore. Whenever that happens, how do you feel?
I think understanding that sometimes it depends on who is talking. What I mean by who is talking is if it's relapse talking or it's someone in their sane self saying, I can't do this anymore. 1 year is a long period of time, and even a few months or a few weeks being inside a place, it's actually something that would tell on your mind, especially when you're alone. So sometimes when I hear that, it doesn't necessarily shake me to say, oh, I want to leave, I want to move, because it depends on, like I said, what is talking inside of the person. So through further conversations with the person or sessions, when I'm sure of what is really going on, by asking questions that, we understand and we're able to help the person and convince the person to say, this is why you came here. So sometimes we ask them, why you coming? Why you come? It's part of the questions we ask. Why do you want to go through this?
Why do you want to be here?
Why do you want to be here? So when that time comes, we revisit the why. Do you remember why you said you want to be here? So if your reason was maybe, for instance, vocations, or it was just a shelter that you were thinking that you would have while you come in, then you won't be able to even stay for the long run. But even if you are coming for the long run also, you can get tired, actually. Those days can come. So it's not for us to now say, oh, this is happening. It's now to sit you down and help you understand and go through the reasons why you were here in the first place. Try to encourage you. Also, that's why family is also important. We integrate, if the family is interested, or they're in support rather of the resident who is in, the family can speak to the person and also give emotional support. So many times that in itself helps a whole lot as well too. So
this is so profound. It's so profound. I want to believe that for a rehabilitation center that is free, living with loads of staff, that's quite capital intensive.
Yes.
And I want people to understand that the purpose of this is not profit. No one runs a rehabilitation center like this that is free for profit. All right? This is one out of many things and many initiatives that is being done by members of the body of Christ. The Redeemed Christian Church of God as a rehabilitation center. In fact, they have centers across board, and most of their facilities are overwhelmed. I want to thank God for men like Dr. Tony Rapu, who has been inspiration over the years. And, going out on the street, getting people out from the creeks, rehabilitating them. Want to thank God. People like Pastor Christy Bature. So we've seen, and I think this aspect of the body of Christ is not often being talked about. And sometimes I think people are just not sincere enough to want to, because I get it, that there seems to be this sense of disdain whenever the idea of church or pastor has been mentioned. But, and this is not a way to also beat your own drums, but this is a way just to call to awareness that, hey, things are actually happening.
Yes.
And not everyone will come out with trumpet too. I remember when we were going to start this rehabilitation center, it cost us tens of millions.
Yes, sir.
Tens of millions. And that's the reason why, for now, what we have is just female wing, female facility. We are trusting God that before the year ends, we are going to have a male facility, of which the number of calls on ground, the males on ground,
most of them,
the facility that we don't have is already overwhelmed.
Yes.
So, I'm just saying this because if there are people who are well-meaning, who have been thinking of how we can give back to the society, and I can tell you, this is a noble cause.
Yes.
This is one really project that you can be 110% sure that everything that goes into it is being used for the purpose and to make sure that we sanitize our society. I'll tell you a story. A story of the girl. I think I had a session, and thank you for reminding, because we have to even do some things for the family. The story of a girl that I was being told. I think at 21 or thereabouts, she had given birth to 5 children. And none of them survived. Is it 5 or 6? Except one. And She had aborted several times. She gave birth, they steal the child, and some other things like that. By the time they were telling me her story, I was so interested in her story. So I said, get her for me right away. And they said to me, she died just yesterday.
Oh, no.
So there is a community of people that it is not just enough that we reach them. It is even important that we reach them on time.
On time.
So when it comes to rehabilitation, when it comes to getting people off the street, it requires timely intervention. It requires timely intervention. It's not something that you want to wait. Sometimes you say, okay, you know what? We come get this person next week. And you get there and the fellow is dead. You know, so these are things that, you know, we need to be aware about and to look for, to see how we can, join force together and then make this work.
Yes.
All right. So as we begin to wrap this up, let me just ask you a few more questions.
Okay.
And I'm going to ask you as the director of this. You are so passionate about rehabilitating these girls. I've seen you cry. Probably because one of them was misbehaving or someone opted out. I've seen you break down. I've seen you do it with such a level of passion. And I remember whenever you send budgets, I was touching, I have to talk about that publicly. I was touching the things that needs to be bought, and I'm like, oh God, the Mlade has come again. Oh God, he wants us to buy this foreign, this foreign, that. I'm like, but I like it because this is real passion.
Yes.
Why?
Okay, so way back in school, I remember I started watching Pastor Tony Rapple's videos.
Yes.
And at that time, I didn't even think I would be here. But I remember how I would watch those videos and I would be moved to compassion for those people. But at that time, I was also leading a female-led ministry, She Blooms Network. And then I would go to...
She Blooms.
Yes.
Thank you for that.
Yeah,
Powerful.
so I would go to...
You did a lot of
schools.
work with She Blooms.
Yes. Yes.
Are you still running She Blooms Network?
Yes, I am. In fact, currently, we're planning to have a major outreach to brutals.
So we're going to talk about She Blooms because we need to push it out there also, so that while this is going on, people can also know about She Blooms Network. And then if there are details for support and account details, we'll also put it out there.
All right.
But continue.
Okay, so I remember how I would go to I went to a brothel and I remember meeting a couple of ladies who were there, and some of them were doing it because they needed to fend for their family. I remember one girl in particular who had said she was sending her brother through school. She herself wasn't in school at the time, but she was sending her brother through school. And the truth is, at that time, I couldn't even help. So by the while they are doing sex work, somehow they'll get into drugs as well by association.
The cycle is the same.
Yes. Yeah. So they'll do that and then get into drugs because it's just, they're on the streets and then you do drugs. So in fact, even though you go into prostitution just to maybe get money or something or even trafficked for some of them, but somehow you just get to that point where you're into drugs already and then the cycle just continues. And for me, it's something that eats me so hard because I just can't, I can't imagine how that the devil messes with your mind so much that you can't think of any other thing to do than be in that place. And it's like, for me, it's like the lowest of the lowest points that you can be. And I just realized that I feel like there's been this burden to just pull these people out of that place, to see yourself that there's more to you. There's so much more to you. There's so much more you can become. You can't just leave yourself in that place, and then just allow yourself go, no matter what the circumstance is, So for me, I'm just driven by that. And I remember even working with Bethesda Child Care Agency at the time. That as Pastor Tony Rapo's wife's agency,
Yeah.
and I was there. I was there as the counselor at
Yeah.
the school, and while I was there, I worked with quite a number of them, the kids there, and even for them, many of them, some of them were already taking our drugs.
Oh,
You know,
wow.
and that's because of the community that they stay in, you know. So you hear them say quite a number of things in the environment where they stay. What they see is teenage pregnancies. So many of their parents are
They are
teenagers
when
who
they
gave
to them.
birth
Yeah.
as teenagers.
The tale of babies raising babies.
Exactly. So the cycle they see. I remember one session I was having with them, and one of them said, "Man, you can't make it in life except you're a Yahoo boy, or you're like a man helps you as a lady
Yeah.
to make money," you know. And that's those hearing a teenage boy or a teenage girl say that, it just shows that something is wrong with the environment where they stay in. And this happened. This is all over, everywhere. I've been to brothels in Ibadan, Lagos, in Abuja here, in so many places, and even in different things.
There's drug epidemic out there.
Exactly. And even from my school days, seeing people go into all these things. I had a friend who we used to be friends together. And then I remember how I saw her leave that phase from being a normal human being, going through depression, and then started rolling with people who were taking drugs. And she just went down. And for me, I'm like, okay, how do you bring this person back? She went so deep into it. She changed. Yes, she changed. She was so beautiful. She changed into someone I could not recognize her. You know, that was very painful. That was very, very painful. In the hostel where I stayed at some point, I remember going to pick up, I think, my charger from someone else's room where I was charging. And I saw a guy that was coming to me, and he was naked, stark naked.
Why?
Almost in the middle of the night. Why was I on drugs? They had to chain him down, you know. So they had to chain him down and wait for his parents to come and pick him up in the morning.
In female hostel?
It was a mixed hostel, male and female. I saw him walking so fast towards me, and I was confused because I'm like, what's going on? Who is this person? I had to run back to my room. I was so scared. I didn't know what was going on, but that was drugs, you know, and it didn't stop him from not, you know. And that's the thing. He didn't stop his friends or the clique from stopping it, even though they knew what it could do
The drug
to them.
epidemic around us.
It's really bad.
Is it stopping anytime soon?
I feel like one of the things that needs to be done is advocating, like, really hard. And you see a lot of boys now going to school, just like she said the other time. And in fact, most universities private universities expel a number of people almost every session. In fact, every session,
Yes, I know
because
about
of
that.
drugs.
Because of drugs.
You know, so you ask yourself why, you know, they're doing parties, you know. So I feel like the epidemic is is so much and it's so bad that, you know, when you have the taste of, I've never had it before, but then I feel like once you have a taste of it, it feels so good and all of that, you want to continue.
You want to get it more. I mean, this is a lot serious. What's your advice? And this will be my last question I'm going to ask both of you. For individuals, particularly believers, who have loved ones, who have issues with their mental health, particularly around psychosis. Maybe children of pastors, children of respected leaders, who have these issues of substance abuse and that affected their mental health, or they are hooked on it and it's affecting the quality of their lives. And the family has been keeping these people because of their reputation. What's your advice for such family?
Okay, so first of all, I don't think it's something to even keep, because you're not even helping the person at all.
Yes.
Also, get them help. That's the first thing. Get them help. Most facilities now provide confidentiality. So it's not even something that would necessarily get out there. They are very private
there should be
rehab
confidentiality.
centers
Yes.
that are very private, where the identity of the residents will not be stated out there or exposed in any way or in any form. But they need help. They need all the support that you can get. I think there was a story I heard of someone who's from a respectable family, and they abandoned her and just said, you know, if you need the money for the drugs, we'll keep giving it to you. You know, just stay indoor. And I'm wondering, how does that person become anyone? Because she's already at the point where it's like, doesn't matter. You can't even become anything. So just keep taking your drugs, we'll keep giving you the money for the drugs and just be there or whatever. But they're not trying to get the person help. Get them help. Get them help. Get them the help that they need. They deserve to be helped. I feel like if people, maybe not necessarily that they were not orientated better, but if you had seen yourself in that situation in the long run, maybe you would not have gone into it, but then they're already there and they are loved also. God loves them as much as they were in their normal state and while they're in that state. So even while they're in that state, they are still loved and you should still be able to express love to them.
Yeah.
And what they need is help. So get them the help that they need,
right.
the professional help that they need. Get them help.
That's so profound. I'd like to ask you that same question, but like this.
Okay.
You are a nurse.
Yes, sir.
You've had experience around psychiatric issues.
Yes, sir.
You've worked in that unit for a while. And you are also a Christian.
Yes, sir.
And also a lover of God. What's your advice for people who see prayer as the only solution for mental health issues?
Okay. Thank you, sir. So,
Or do you think it's going to be enough?
no, sir. Of course not. There is the religion, there is the spiritual aspect, and there's also the medical aspect. So I've had experiences in some places I worked where they would give a brief history of the patient before they start anything with the patient.
Yes.
So listening to the history of some patients, you hear that this person has been in some traditional places where they will beat the hell out of them.
And
where
worsen the case?
Yes, they'll make the case worse. So when they are now bringing them to the hospital, their case is now even more worse than how they were from the beginning. So they'll use use so many things. Of course, that is not a way to stop these things. Okay, they need the professional help as well as the religious aspect. Because if you are saying let's just pray, prayer would only sort a part. Because if you are saying, okay, she mentioned earlier that the approach we are using at the rehabilitation center is holistic, is all round. So as we are doing the medical aspects, we have a clinic. So as we're doing the medical aspects, there is also the counseling aspect. There is the spiritual aspect as well. So all these things work together to make a whole being, to make a whole person. So it's very important that we bring together the collaboration between the doctors, the nurses, that's the professional aspect, together with
the faith.
I'd like to really
aspect.
thank you for that answer. And I'd like to say this, that we must understand, probably because of my background, and that's why I'm able to say this, because sometimes we've made mess out of people's life by trying to provide one-sided solution to some things that requires professional intervention. Now, I say this with all sense of responsibility as one who also is a pastor, all right? And I understand the balance. I'm just going to say this to you, that we must be conscious to understand that God who gave the medical knowledge to those who are in that field, all right, that in itself is a miracle. And it should not be denied to those who need access to it so they can get the help that they really need. And if you are not a professional, you might not be able to really get them the help that they need. And it's time we start balancing, everything. I'd like to thank you guys for coming. It's such a joy hosting you guys. And I'd like to say this on behalf of the general public, that I would like to see more content from Femi Lazarus Rehabilitation Center.
Yes,
you spoke about advocacy. I have to put you out there.
Yes.
You spoke about advocacy. We have to see you advocating more.
Definitely.
We want to see you guys on the street and the things, and then we hope that we're going to see that happening. And then for those who want to support and be a part of Femi Lazarus Rehabilitation Center, you have the account details on the screen. You have everything that you need on the screen. You have the number, you have the mail, you have the account details. We really do need your support. And as a matter of fact, we need to start the mail wing, because that's where we have more issues. And we're trusting that God will raise help. And I want to say this, that commencement, everything was single-handedly funded. We did not get anything from any public, anybody, anywhere. And then, but at this point, we will say that we need more people that can join us, to make this a success and be able to get the mails out there. I'm such a joy to have you guys.
Thank you so much for having us.
On this episode of Stories.
Thank you so
I
much.
don't know what kind of story we'll call this, but I just say it's been a fantastic conversation with you guys. And I look forward to having you again. And this time around, talking about other stuff, maybe hopefully stories of, not hopefully, definitely, stories of those who have been completely rehabilitated and how they're doing.
Yes.
God bless you so much.
Thank you so much.
Thank you, everyone, for connecting with us this evening. I'd like for you to share. You want to invite someone who you feel need this knowledge, and subscribe to this YouTube channel if you have not done that, and click on the notification to get quick information from us anytime our team puts something really remarkable online. Thank you so much. I look forward to seeing you again. Bye-bye.